Hi class, welcome to Module 3. We're looking at Chapter 3, the social distribution of illness in the United States. And we'll begin by looking at the United States, but obviously within this course we're looking at other countries and other types of healthcare as well. But let's focus on what we know and where the issues are within this process. Note that no matter what, as we explore the topic of the sociology of medicine, we are facing continued changes in society. We know that the difference is looking at the Affordable Care Act, that it come into place, that decreased the number of people without insurance. It directly impacted these social factors that affect illness. We're currently at the point that the federal government is no longer providing support for the Affordable Care Act, even though it hasn't been legislated out of being, that new movements have said that people are no longer required to have health insurance. So all of this is constantly changing. However, when we look at the direct effect of illness, we can see that these three issues, social class, race and ethnicity, age, and sex and gender, are a vital part of what does affect illness. So we'll begin to look at, well, social class refers to a person's position within society, the economic and social hierarchy that they fit in. We often look at social class being poverty, working class, middle class, upper middle class, and upper class is where we look at those things. We know that there's an economic difference that comes into place in each of these categories. And it's not just the money we earn, but also the wealth that we own. So social class is about both income and wealth coming together to put us in a particular position. Very clearly, we can see that there are significant issues that come into place with the differences that are accessible. So someone in a middle class, upper class, has the opportunity to reach out and be part of the medical network, that they can afford to go to the doctor, that they can look at those examples. Those things are pretty substantial as we come into place. We also know that there are significant differences based on class related to the environment that we live in or we're placed in. So if we live in a dangerous neighborhood, we're more likely to have some illness issues. We could have the stress we talked about in the last. We could look at the conditions, the poor living environments come into place. And then we could be in a place that is inadequate or overcrowded or unsafe housing. Social class also affects the amount of food we have available to us, but not only the amount of food, but the type of food available. When we're in a position where there are economic issues that affect the food that you can buy, processed food is cheaper than fresh food. So what do poor families live on? It makes a difference in what areas we live, whether there is food sufficiency or insufficiency, whether we live in food deserts, such as in rural areas where you have to drive 50 miles to get your groceries, or in food deserts in inner city where what is available to you is only the quick convenience stores who carry very little because it's so unsafe to have a large mega grocery store in that process. We can see that that is significant, and that poor food issues affect children at a very high level, affect illness if people aren't eating right, and that access coming into place. Pretty powerful as we start looking at how powerful social class is to determine health factors. People of lower social class have less length of life expectancy, and it's very much tied to these multiple factors that come into place. Now, race and ethnicity also play into part. We know that there are racial and ethnic backgrounds that affect people's health, that there are certain diseases that tend to be passed down for family line, but even more so, we can see the effect that goes into place related to the stress of our ethnicity, the our background, what we've passed on, our heritage, our food styles coming within. I think it's interesting. Years ago when I was first studying nutrition, and for those that know me, they know I come from a home ec background um, and family studies. But when we were looking at medical, we were finding with physicians who didn't support the reality that your food choices made such a difference. If I come from a racial background that lives on fried pork and the fat back, we can see the significant differences. Clearly, when we look at country difference wise, the highest life expectancy comes out of Hong Kong and Japan. Their diet is completely different. Whole grains, lots of fish into place, not so much the red meat, the other things. We don't see the same issues of being overweight that come into place. They're pretty significant as a social factor. We see the differences with African Americans as we look at their background. We can see that poverty can affect infant mortality rates at high levels. And what's interesting is when we weigh this, we have to be very careful. Remember, African Americans in our country, 50% of them are middle class, but there is a higher percentage in poverty. Then we look at Hispanics, which are very interesting. And again, their diet comes into place, their family background, all of that, the family support. They're considered the Hispanic paradox, that they actually have a healthier lifestyle than other people that may be in poverty. And then there's the Native Americans. And they're very diverse in their background. So we lump together Native Americans as the Native Hawaiians, the Native Alaskans, the Aleuts, all of those, as well as the Maine America, Native Americans. And we know that they have the shortest life expectancy, that they oftentimes are affected greatly by their background. The same can be said by the Asian Americans, and we know that diet comes into place as well as lifestyle in affecting that. Other social factors that affect illness include age. Younger people are healthier. Older people have more chronic illness, and chronic illness comes into that fact that people continue with some individual differences based on their ethnic background that are brought into aging, and they may be less healthy. So we see the rates of illness, including disability, mortality, and the rates of illness being higher among older adults, both by their background as well as we can see the difference that is spent. What's interesting as we look at the aged population, they are the only people with basically a national health care plan other than veterans. So with age, then at 65, when they qualify for Medicare, they have a form of insurance, not that it pays for everything into place, but that too affects their social factors. And finally, when we talk about it, not only about age, but we have to talk about sex and gender. And there has been a feminization of healthcare that reflect the differences. Now, there are diseases that affect women differently than men, and even the treatment of illness really comes into place as we look at who has health care into place. Women are more likely to seek medical attention. They're more likely to pay attention to it. Also, they're they're less likely to live dangerous lives. So when we look at mortality differences, we can look at the difference significantly between women and men. More men are born, but by the time we reach 35, from the difference of those dangerous lives and the other things that come into place related to men and illness, by 35, women are more outnumbering men at that age group. So there is this whole picture of gender as we start to explore coming into place. So there are multiple things that come into place as we look at the issues of illness. So social class, higher social class equals lower morbidity. Income itself has a greater effect on health than does income inequality. Poverty definitely adds to the issues of health, but it only explains a small percentage of illness. Poverty can cause illness. We can see the stress, as we talked about in this situation, the unsafe housing, the lack of food, the poor nutrition, the lack of access to health care. So many things as we explore this. As we look at race, this social construct, we know that race has no biological basis, but it's constructed and it puts people into that. Social class explains many of the health differences among the ethnic groups, but ethnicity also has this independent effect by even our backgrounds of what we believe and what comes into place and the support. So we know that African Americans, for each age and all income groups, African Americans have higher mortality and morbidity rates than whites. We've talked about the Hispanic paradox here, and the difference may be their work level, what they come into place, as well as their diets, their family backgrounds. We know that Asians overall have the better health than other Americans that come into place. But here's the concern, the high risk for Native Americans, who actually have the lowest statistics out there, the high rate of alcoholism and alcohol-related deaths, a high rate of diabetes. Interesting studies as we pull people off natural diets and we increase their level and dependency on available food, and that's more processed food. We see this rapid increase of diabetes, and we see the issues of overweight as well, and more post neonatal infant mortality comes into place. Age, as we mentioned before, mortality rates drop after infancies, and they rise and continue to be healthier until 40. And after 65, we face chronic illness. And chronic illness is predominant in all of first world countries where the aging population is growing at such a level. Remember, there are significant issues. If you've taken sociology of aging, you well know what comes into place here as we see the middle age and baby boomers are rapidly growing, and the fastest growing segment of the population is 85 plus. Those 85 plus, about 50% of them have some form of memory loss, and that affects their illness as well as their chronic illness of having disabilities as we start to explore those. Sex makes a significant difference. Remember, sex is biological. Gender is the social construct that comes in place that drops us into the categories of male, female, bisexual, all of those coming into place, and they do affect health. Women get sicker, but men die sooner. There are biological reasons for that as well as sociological reasons. So men as children are more susceptible to diseases. We see a different way that their body fights, but there's significant social reasons that I mentioned earlier, such as living more dangerous lives. Men that are married stay healthier. they change their lifestyle. And we have this issue of intersexed. Your presentation this week in your module will have you look at intersex, so we will leave that discussion out of the process. Significant issues as we come into place, looking at this issue of the social distribution of illness. To finish this section, you need to examine the issues of social capital. Social capital refers to the resources available to the individual through his or her social networks, that they are significant in how we look at what happens and what comes into someone's life related to healthcare. It's interesting as we explore what that social capital is. It includes the support of family. It includes those social networks, the social class, your job, your gender, your age. All of those things tie together and are part of this structure of looking at the distribution of illness. So you've watched this video. Your next step is to read the chapter. And then I'm asking you to view a video that was made in England on some new research that's done related to intersexed, just to give you more information at a deeper level than I can give you or that the book gives you in that process. Then move forward to your discussion board. Remember, you need to enter your initial post by Wednesday and then come back and follow up with at least 3 comments. Significant comments, again, refer to your rubric within that. Your assessment for the module, again, this week is a multiple choice quiz. Please let me know if you have questions, and you should be well on your way to your first assignment, which is your interview with a healthcare professional. You will be doing a discussion board on that after you've completed that assignment. With that said, I look forward to hearing from you. Have a great week.